I'm Dr. Hendrickson with UT Health Jacksonville. Here are the top 5 questions you need to know about diabetes. We think of 2 types of diabetes, type 1 and type 2. Type 1 diabetes usually is diagnosed in children or adolescents and is your body's inability to produce insulin because of autoimmunity or your body resisting itself. Type 2 diabetes is more of an insulin resistance. So the insulin is there, it's being produced, but your body's not able to use it correctly and therefore drives the sugars up. Typical warning signs of diabetes include increased thirst, urinating very frequently, insatiable hunger, and significant weight loss. About 30% of adolescents, when first diagnosed with type 1 diabetes, will actually present as an emergency called diabetic ketoacidosis. That's from the sugar being too high, and they'll have symptoms like confusion, significant pain, and other varied symptoms. It's always a good time to contact your doctor if you're experiencing any of the warning signs that we just talked about. It's also a good idea to come in and see us if you're over the age of 35 and have never been screened for diabetes, or if you're overweight and have any other risk factors such as a family member with diabetes, especially a parent or a sibling, previous high blood pressure, previous heart disease, diabetes when you're pregnant, and several other risk factors. So the typical treatments for diabetes, we always think of insulin. Insulin is used kind of as a last resort in type 2 diabetes, but it's the mainstay and kind of the standard in type 1 because your body's not able to produce the hormone itself, so you have to get it from an outside source. In terms of type 2 diabetes, we often use pills, and then there are some new injectable medications on the market as well, and the goal is basically to help your body handle the insulin better, handle the sugar better, and provide better control overall. Complications of diabetes can be varied. They affect many organs in the body. Things that we typically check as physicians or providers is usually, we recommend that you check your eyes once a year if you have diabetes, we check your kidneys frequently, and we check your feet to check for nerve damage, but there are other varied complications, including significantly increasing your risk for heart disease.